Hi, I'm Shreya Patel and I'll be talking to you about vocal cord dysfunction. You're probably wondering what this is because you often don't hear about disorders involving the vocal cords. Well, vocal cord dysfunction, or VCD, is where your vocal cords don't act normally. Instead of them opening up when you breathe in and out, they close, which makes it harder for you to get air into and out of your lungs. There are many kinds of signs and symptoms associated with VCD. These include things like shortness of breath, the feeling that it's hard to get air into and out of your lungs, tightness in the throat or chest, frequent coughing, a feeling of suffocation, noisy breathing like wheezing or raspiness, and a hoarse voice. There are also many causes, like upper respiratory infections, strong fumes, tobacco smoke, acid reflux, or even exercise. People confuse the exercise part of the cause with exercise-induced asthma, but the medication asthma patients use don't work on VCD patients. Vocal cord dysfunction is often confused with asthma due to their similar symptoms, and patients are often misdiagnosed with one or the other, but there is a major difference. While asthma patients take a breathing treatment with albuterol and it opens up their breathing tubes, this is not the case for VCD patients. Instead, they would need to learn to control vocal cords and relax throat muscles. VCD is also confused with stridor. Stridor is an abnormal, high-pitched sound caused by a disrupted airflow and narrows the upper airways. It is different from VCD in that it is a symptom, not a disorder or disease, so it would be really important to find the underlying cause. Another difference is that it is seen more in children than it is in adults, where VCD is found more in adults between the ages of 20 to 40. It can be seen in children as young as 8. It is found more in women than it is in men. VCD is a rare disorder. It affects less than 20,000 people in the United States. It is defined as a rare disorder because it affects one person per 2,000. It is a relatively new discovery and first appeared in medical literature in 1951. In fact, it was commonly characterized as a symptom of lying by the patient. The most valuable diagnostic tests for VCD are pulmonary function testing with full volume loop and flexible laryngoscopy and measurement of arterial blood gases. You may be wondering why I chose a specific topic. Well, I was diagnosed with this about 4 years ago. Around that time, I was admitted into Cook's Children's Hospital for difficulty breathing. The reason I was admitted was mainly due to the fact that they couldn't really figure out what was wrong with me, so they couldn't diagnose me, which meant I couldn't be treated. My blood oxygen level ranged between 98% to 100%, which showed the normal amount of air was getting into my lungs. The normal range for blood oxygen level is between 90% to 100%. I was at the hospital for about 1 week, and within the first couple of days at the hospital, the doctor suspected I had VCD. However, VCD only happens while the patient is awake. This is because it makes a person think they cannot breathe, causing a panic attack, which in turn causes wheezing. My mom told the doctor that in my case, I was wheezing while I was asleep. On one of the nights, my mom heard me wheezing while I was asleep, so she quickly called the nurse. The nurse confirmed I was asleep, my blood oxygen level was at 95%, and yet I was wheezing. The doctor was surprised when she read the nurse's comments on my chart, so she requested a more in-depth procedure. After that came out negative, I was diagnosed with VCD despite the fact that wheezing while asleep was still a mystery. I had been to the emergency room more than once before being diagnosed, and the doctors just kept telling me to calm down or try to relax because they thought it was related to stress. They gave me a saline solution, and after that didn't work, a helium and oxygen mixture which reduces airway resistance. This did help, but only for a limited period of time. At school, about a week later, in the middle of the day, I felt really dizzy and lightheaded, so I asked to go to the nurse. On my way, I noticed I was sweating and tears were pouring down my face. It was back. I felt like I was choking. I got to the nurse and I couldn't speak. She had called the ambulance because my heart was racing, I was shaking, my lips were turning blue, and my blood oxygen level was at 80%, which was really low. When we finally got to the hospital, they kept asking me questions and I couldn't answer, which got me really frustrated, which in turn made my breathing worse, because you're supposed to relax the vocal cord muscles, instead they closed tighter. They gave me a breathing treatment, which is supposed to help open up the vocal cords. It helped get air into my lungs. My parents finally got there, and the ER doctor told them this was something not related to stress, but it can play a role in it. Along with being diagnosed with VCD, they diagnosed me with severe allergies. Severe allergies triggered the onset of VCD, but it was not the only cause. Although I wasn't really happy about this, I'm happy they had finally found a solution. Thank you.